So in terms of COVID, very good news, no new cases today. We do still have 15 active cases in our state, however. And we also, unfortunately, have 2 people still in hospital at the Royal Adelaide. One man in his 30s who's stable and a woman in her 30s who is in ICU. Now, unfortunately, she has needed to be intubated, but the update today is that she's stable, and of course all of our thoughts are with her at this time. But it is a reminder to people that this disease is not just severe in elderly people. Here is a very young person who has really had a very nasty bout of COVID-19 and obviously needing to be in ICU really shows how severe this disease can be, and is absolutely the reason why we are urging all South Australians to become vaccinated when it's your turn. Now, people will be interested to know what's happening at the Playford, and I do have an update on our investigation there. So all staff at the Playford who were working during the time at the Playford between the 25th of April and the 4th of May, and this is the time that we were concerned about hotel transmission, now we can say are up to date with their daily testing regime, and we've checked up with all of those staff. There were 5 remaining staff who were not able to be contacted because they were not at work, and we were able to follow those up late yesterday, and they've all been confirmed to have been tested. And in addition to that normal testing regime, 104 staff were tested at the Playford on Tuesday, and all of those tests have come back negative. We've also ensured that all the guests that are currently on level 3 at the Playford are negative, and all of those guests have been retested and those tests are negative. So there's no current risk to anybody at the Playford, which is important information. The 34 people who were guests and were travellers and had been discharged from that facility from level 3 between the 25th and the 4th have all been contacted by our CDCB team. There were 10 of those people that remained in South Australia, and we have required those people to have another 14 days of quarantine. But because of the lower risk, we are allowing those people to quarantine at home if they do have a suitable place to quarantine. There were 3 people that needed to have another 14 days in the Medi Hotel because it wasn't their home wasn't suitable for a quarantine facility. The other thing that the teams have been carefully going through is reviewing and re-reviewing the CCTV footage and also the ventilation, and we had infrastructure staff who went and checked that the 2 rooms that we were interested in yesterday. And there is nothing that has come out of that investigation that gives us an explanation about how the person who returned to Victoria could have got infected. However, of course, we are as keen as anybody to get to the bottom of this, and we're continuing some other leads in that investigation, and of course we'll be updating people if anything turns up. But at the moment, I'm very confident to say that there has been no risk for people in South Australia, but I do obviously acknowledge that it's been very difficult for Victoria having that additional case in their state. Now, I'm happy to take some questions afterwards, but I would like to pass over to people who have more to say about this wonderful paediatric emergency facility. Thank you.